Once considered isolated cases, diabetes diagnoses have surged alarmingly, with over 1,100 new cases recorded in just 6 months of 2025. As treatment supplies dwindled and humanitarian support recedes, patients, especially children and the elderly, are left battling a silent epidemic with few resources and fading hope. This report has more.
In Marib Governorate, the stories of diabetes patients are no longer isolated cases within health facilities. They have become a widespread phenomenon, shocking figures and silent, multiplying suffering. In just 1 year, the number of people diagnosed with diabetes rose to 1,157 cases, compared to 350 cases the previous year. A deeply alarming number that raises bigger questions about the healthcare system's ability to confront this chronic disease.
We're
seeing a sharp rise in diabetes cases for several reasons, mainly the current economic situation in the governorate, the influx of displaced people from other areas, and the withdrawal of humanitarian organizations. As a result, more patients are returning to the health office. Between January and now in 2025, we've recorded over 1,000 cases. Previously, we used to see around 300 to 500 new cases per year. We may run out of insulin in the next 2 months.
Children and the elderly are the most vulnerable in this frightening surge. They stand at the doors of medical centers seeking a dose of insulin, a pill, or proper medical care, while outside pharmacies drastically raise their prices, leaving patients unable to afford their medication. In light of this reality, healthcare services appear exhausted. Emergency rooms suffer from a severe shortage of medication and specialized staff, and there are no dedicated free clinics to follow up with diabetes patients on a regular basis.
We don't have consistent access to treatments or insulin. Sometimes we receive supplies, but other times we have to buy them ourselves. Just one patient might need up to 50,000 Yemeni riyals worth of insulin, syringes, a glucose meter, and sugar level control supplies. Personally, I've already lost one toe due to diabetes, and now I've lost a second one because of the lack of treatment and proper care. Sometimes there are no supplies at all.
Health authorities, for their part, are at a loss in the face of this crisis and confirm that available resources do not match the scale of the challenge, especially with the lack of support and the rising number of cases day after day. Meanwhile, humanitarian organizations no longer offer the level of services to patients as they once did. This puts diabetes patients up against a new challenge and a looming humanitarian crisis that could turn catastrophic if the situation is not addressed.